Health and Human Services Secretary Robert F. Kennedy Jr. is shifting his tone on vaccinations as measles cases rise, now publicly encouraging Americans to get the vaccine after well-documented skepticism in the past.
The federal government's position, my position is people should get the measles vaccine, but if the government should not be mandating those.
Joining us now is pulmonologist and global health policy expert Dr. Vin Gupta, an MSNBC medical contributor. Always good to see you. Thanks for being here. So we just heard Secretary Kennedy there now encouraging people to get the vaccine. That's quite a pivot from his days of saying vitamin A is the answer here. I guess aside from taking the vaccine, though, the numbers keep rising. We're over 100 or 500, I should say, in Texas alone. What else needs to be done to contain this?
You know, Anna, I mean, clearly, I think there needs to be clear information on how measles presents itself so that people get, if they've been exposed, chances, and they're unvaccinated, the chances are they're positive. And they need to understand what the early symptoms and signs are so that they get tested as quickly as possible so we stamp out this outbreak from worsening even more than it already is.
So what do they need to look for?
So early signs, honestly, measles presents early on with flu-like symptoms, and then it can present with a rash that actually starts up near the forehead and then moves on down. So those are the sentinel signs.
Okay, so here's what Kennedy had to say about these measles numbers this week.
I would compare it to what's happening in Europe now, where we've had 640 cases here. They've had 127,000 cases and 37 deaths. And we're doing here in the United States is a model for the rest of the world.
Do you see us as a model for the rest of the world?
No, because, I think he's trying to distort the data, as he often does. Anna, we already have more cases than we've had nearly combined between 2020 and 2023. We've already exceeded that 4-year total, and we're just in the beginning of April. So, no, we're not a model. Two, what he tends to do, and you and I were talking about this, is he continues to talk about things like inhaled budesonide, which is a steroid, clarithromycin, which is an antibiotic. As you know, I'm a pulmonologist. We have use cases for those medications, Anna, but that's not for the treatment of measles. Those are used in the cases of severe pneumonia from other causes. Somebody has maybe COPD. They are not used for things like treatment of measles. And that's why we're not the model. He's just putting out grossly false information.
And at one point, measles was eradicated here in the U.S. decades ago. And here we are with these growing numbers. We'll see where it goes. Dr. Vin Gupta, as always, good to have you. Thank you.